now. Thank you everyone in detoxification, and we're going to show you how important this is to your health and how toxins in our environment and in our foods can really cause a lot of problems with our health. And that's because we are what we eat, drink, breathe, and touch, and don't eliminate. And what we mean by that is that all of the things in our environment that we're exposed to, all of the things in our food supplies that we're exposed to become part of us if we don't eliminate them. And that's why elimination or detoxification is so important. Every year, the average person is exposed to about 14 pounds of chemicals and toxins and preservatives. So think about that. It's about the same weight as a bowling ball worth of poisons that you have to get rid of every year, or you're not going to be healthy. So it's very important for our bodies to be able to do that efficiently. You can think about toxins coming into our body like water coming into a boat. And here you can see a boat that's got a little bit of water in it. The boat's still floating. You could get in that boat if you weren't too heavy and probably still float. The boat would be okay. But that water in the boat is like toxins in our body. And here we can see if we take on a little bit more water or more toxins, the boat's not too healthy here anymore. It's starting to sink, but it is still floating. Again, you could be sitting in that boat and probably still be fairly safe, but it doesn't take very much more water to now where that boat is capsized, and now you're in trouble. And this is how it is with toxins in our body. We take them in and we're okay, and then eventually that little bit more pushes us over the edge and starts to sink our ship. So what are toxins? Toxins are any substance that can come into our body and cause harm. And in that respect, even something like water can be a toxin, because if we take in too much of it, we become very unhealthy. Too much water can actually cause us to be very sick and even to die in extremes. The GI tract is the main organ that our body uses to eliminate these toxins. And any toxins that come in that exceed the GI tract and the liver's ability to eliminate them is what's called toxic burden. That's the amount of toxins in our body that are more than we can handle. And toxins are fat soluble. What we mean by that is that they dissolve in fat as opposed to water. Just like olive oil, for example, does not dissolve in water, neither do toxins. And because of that, they're stored in the fat tissues of our body, which makes them somewhat difficult to eliminate. This was a study that the EPA did a few years ago, where they did fat biopsies on people, and they looked for dioxins, PCBs, dichlorobenzene, and xylene. These are very common organotoxins in our environment, and what they found was that 100% of the biopsies had some of these things in them. Dioxins and PCBs can cause cancers. Here's a study by Columbia University that showed that 95% of cancers are probably caused by diet and environmental factors. And styrene is also a known carcinogen. And we also get toxins in our food supply. Our food supply has become so burdened with pesticides and preservatives and chemicals that it really now is a chemical system and not a food system. And it's important for us to get back to whole foods in our diet. This is a list, and this is quite a few years old, almost 20 years old now, that shows how extensive the chemical and toxin problem is. At this time, there were 5 million chemicals registered with the government. You can see 7,500 chemicals in our cosmetic ingredients. Over 2,000 new chemicals a year are registered. So this is a growing and a very important problem that we have to deal with. And of course, we have the Environmental Protection Agency of our government out there to protect us, right? Well, maybe not so much. Back in 1976, when the Toxic Substance Chemical Act was passed, gathered in all 62,000 chemicals that were registered at that time. So all 62,000 of those chemicals were never tested for safety. And those included things like PCBs and dioxins and even asbestos, things that have now been proven to be but again, how many more of those 62,000 things that we're exposed to that the government allows out there because they deem them safe are really not? This, for example, is PCBs, which again have been marked as toxic and taken off of the market years ago, but we're still at risk for them. And these things cause hormone problems, they disrupt our immune system, they can cause cancer and increase birth defects. But again, we're still exposed to them in our food supply, especially our fish. Here's a diagram showing the Great Lakes. The very dark red areas are areas is very, very high in PCBs. So therefore the fish get exposed to it, and so do we. So even though these things have been outlawed for 30 some years, we're still exposed to them every day in our food supply. This shows what's going on in farmed salmon, for example. PCBs are very high. DDTs and other chemicals, insecticides, pesticides, hormones, artificial colorings and flavorings. Many of these fish are ripe with infections because of their closed farming nature. So we need to be very careful of things like this. You know, farm salmon is one of those things. You might think you're being healthy by eating salmon, but if it's farmed, you're not. It's really very unhealthy and something that really should be avoided. We are exposed to toxins in our air supply, of course. We all know of air pollution, exhaust from chemicals in factories. There's heavy metals in exhaust from coal factories. So any factory that burns coal is going to be exuding mercury and other heavy metals into the air. Those metals then, when it rains, get into the soil and then get into our food supply. We're exposed to toxins in our cosmetics and skincare products. Very, very high rates of toxins in those things. Nicotine and alcohol and caffeine, of course, and then even drugs that we take, prescription drugs and over-the-counter drugs, are really still toxins because our body still has to detoxify those things. The skin, again, is a large problem. By the end of the day, the average woman is exposed to 126 different chemicals through cosmetics and skincare products that she puts on her skin. The skin is very good at absorbing these things, and they can definitely become toxic problems that we need to deal with. Parabens is a very common synthetic preservative found in skincare products, and this has been shown to cause hormone disruption. It mimics estrogen in the body, can cause infertility and birth defects. Fragrance is another ingredient that you'll see listed on a lot of skincare products, and this is something that absolutely needs to be avoided. It's a catch-all phrase for many, many chemicals and toxins that when they say fragrance, they don't really have to identify what they are. And this shows some of the problems that these compounds can have. Many of them are labeled as toxic compounds in Europe and are illegal. The state of California has labeled many of these chemicals toxins. So again, when you see the word fragrance, you need to avoid that. We're exposed to toxins in our water, of course. We all know the problems that Flint had a few years ago with lead, but Flint is really just the tip of the iceberg. Here's a map of the United States, and all of the dark counties on this map have water supplies that have more lead in them or more toxins than Flint did. So it's not just Flint. It's really all over the country that our water supply is not very healthy. We get toxins through our food supply and through our soil. Again, as I mentioned earlier, for example, the exhaust from factories gets into the air, it then rains, that drags these compounds into the soil, which then gets incorporated into our food supply. So we have to be careful of that. Our meats and animals that are farmed are fed hormones and antibiotics, and then we get those things. Remember, we are what we eat eats. So what that means, whatever the cows and the pigs and the chickens eat, that's what becomes part of us. So all of those toxins and antibiotics that they're exposed to, then we also get exposed to. Our food supply, very high in refined sugars, processed foods, preservatives, all of those things are toxins that we need to get rid of. This is a list that's called the Dirty Dozen, that's put out by the Environmental Work Group, www.ewg.org. And these are the produce items that are the most highly contaminated with preservatives and insecticides. So these are things that if you can get these things organic, you really want to. These things are very, very high in toxins. Likewise, the Environmental Work Group also puts out a list called the Clean 15, and these are the 15 cleanest foods that if you don't get these in organic form, they're probably okay. Much better than the Dirty Dozen. As I mentioned earlier, cleaning products are very high in toxins. These are things in our house, all of the cleaning supplies under your cupboards, laundry detergent, all of these things can be very high in toxins. And it doesn't take long for these to get absorbed into our system. This was a study where they looked at how long it takes for these household cleaning products to get into our system. And just 26 seconds after opening and starting to use these cleaning products, we inhale the fumes and they get into our blood supply. And this shows here, this was a study that our indoor air is 2 to 5 times more polluted or toxic than outdoor air. Our homes are so tight these days, we don't get good turnover of air. And so these cleaning supplies that we use get trapped in our homes and then get incorporated into our bodies. This again is the Environmental Work Group website where you can look up all of these cleaning supplies and skincare products, and they can give you a grade of how toxic they are or not. So you'll want to look up your cleaning supplies on this website and see if you're using the least toxic things that you can. And we also have internal toxins that we need to deal with. Things like bacterial and yeast overgrowth in our intestines, undigested food or things in our food supplies, and then also things like stress, toxic relationships, or trauma. All of these things harm our body's capacity to detoxify, and so they add to our toxic burden. This here is a barrel similar to the boat analogy. This barrel is our body's capacity to detoxify things. So all of these harmful toxins come into the barrel every day in our body. And if we bring in more than we can get rid of every day, eventually the barrel starts filling up. And once it fills up and overflows, now we start having problems. Things like problems to our immune system, our endocrine system, neurologic system, liver problems, kidney problems, cancer. So all of these things can result from our barrel overflowing. And we all have different sized barrels. This is a way to say that we all have different capacities to detoxify and handle these toxins. So that's why 2 people can live in the same house, exposed to fairly the same toxins, and one person may be sick and the other may not be. And that's because we have different sized barrels. What are the signs that we may be toxic? It can be varied. Toxicity can really result in problems to any organ system in our body. And so we may have migraine headaches. Digestive systems are very common. IBS, bloating, gas, diarrhea, constipation. We may have low energy, mood swings, irritability, anxiety, brain fog, problems concentrating, muscle pains, fatigue, lethargy. All of these things could be signs of toxicity. So why should we do a detox? This was a study done about 10 years ago that showed that when they looked at 148 different synthetic, the average person had 116 of them in their system. And these are things that aren't supposed to be there. So we all are exposed to toxins that our body has to deal with. This was a study that found Roundup, very common chemical used in our farming, that we find in most foods these days was found in mother's breast milk. So our babies are even being exposed to these things. This was a study where they looked at the umbilical cord blood, and they found glyphosate, which is Roundup, in umbilical cord blood. So even babies before they're born are being exposed to toxins that their bodies have to deal with. Detoxification can be an excellent way to jumpstart a diet. If you've dieted and tried to lose weight and you just yo-yo back and forth and can't really lose weight, it may be because you need to detoxify. As I mentioned earlier, toxins are fat soluble, so they're stored in our fat cells. So if you think of our fat cells as like a beach ball, and it's full of toxins that it's storing there. And when you try to lose weight, or when you do lose weight, you don't really lose fat cells. What happens is your fat cells that you have shrink. So that beach ball now shrinks down to maybe the size of a grapefruit. And as it does that, there's still the same amount of toxins inside of that beach ball or that grapefruit. And so as it shrinks, the concentration of the toxins goes up. Your body doesn't like that. It interprets that as being more toxic. So what happens is it wants to try to blow that fat cell back up to lessen the toxicity. So it tends to resist your wanting to shrink down those fat cells or lose weight. If we detoxify and we get those toxins out, now that beach ball can shrink down. The concentration of the toxins does not go up, it's lessened, and now that fat cell will stay small instead of wanting to get big again. So detoxification can be a way to help your body's fat cells shrink and stay smaller. So how do we detoxify? How do we lower that water level in the barrel or in the boat? We do that by a few different ways. As I mentioned, the GI tract is the main way that our body detoxifies and gets toxins out of our system. And it does that through the liver and the bile and the stool. We also excrete toxins into the urine through the kidney and through the GU system. And the other way that a lot of people don't realize is that we excrete toxins in our sweat. So our GI tract, by all means, is the most important organ system to detoxify. And so because of that, it's important for our GI tract to be healthy. What does our GI tract do? Well, it digests our food. It eliminates waste. It's important to have healthy microflora or our microbiome. And it's important to have good gut integrity. So it's important that our digestive system work well, that our food digests well, gets broken down into small products, vitamins, nutrients, minerals that our intestine can absorb and our body can use. It's important that we have lots of good vitamins and nutrients to detoxify. It's also important that we eliminate well. If we're constipated and not eliminating, we're not getting rid of those toxins. Or if we're having diarrhea all the time, then the toxins aren't getting excreted well. So it's very important to eliminate well in order to detoxify. The microflora balance has to do with the GI tract microbiome. All of the bacteria and viruses and yeast and fungus and things in our intestine that are supposed to be there for us to be healthy. Those bacteria are very healthy. They're important to help break down products, and they're important to help detoxify. And the last thing is the gut integrity, and that has to do with the integrity of the gut lining. The gut lining is one cell thick. It's like a brick wall that protects what's in our intestinal tract. And if that intestinal tract gets inflamed because we're not eating healthy foods or because of things we're exposed to, then the mortar between those bricks starts to break down and the intestinal tract starts to leak, what we call leaky gut. And then things can get into our system that aren't supposed to. Our immune system gets activated, and that sets off inflammation. And all of that impedes our body's capacity to detoxify, but it also allows more toxins in that we have to now deal with. The next thing is our liver. Our liver is by far the main organ for detoxification, and the way it does that is through a couple of different chemical reactions. As I mentioned, toxins are fat soluble. In order to get these toxins out of our body, they have to be converted into water soluble things. Our urine is water soluble, the stool in our intestinal system is water soluble. So those toxins have to be converted to water soluble things. The liver does that by two different chemical reactions called phase 1 and phase 2 reactions. Phase 1 is like processing those toxins, getting the garbage ready to be taken out to the street. And phase 2 is like the garbage getting picked up at the street and taken away. So those two things have to run congruently and in synchronicity. And if they're not, for example, if there's more garbage getting taken out to the street than's getting picked up, that garbage starts to accumulate, and that's not healthy. So it's very important for those two phases to run in synchronicity. This shows that process again. The toxins come in, go through phase 1 reactions, and that requires lots of vitamins and nutrients. And then those toxins get turned into what's called intermediate metabolites. And these intermediary metabolites become actually more toxic than the original toxins. So it's very important that they move immediately into phase 2 and then get converted into waste products that can be eliminated. And you can see that phase 2 reactions also require lots of vitamins and nutrients. So it's important that all of those things happen very quickly and simultaneously. The problem that we have nowadays is that our soil is so depleted of nutrients that even if we do eat healthy foods, we don't get good nutrients that are needed for those phase 1 and phase 2 reactions. This was a study that shows that our food now has 25% less nutritional value than it did back in the 50s because our soil supply is just depleted of many nutrients. So our liver just doesn't work as well to detoxify those things. The other thing we need to think about is all of the medications that we're on nowadays. It's not uncommon for someone to come in and be on 10 or 15 or 20 different medications. Well, all of those medications are things that our body has to detoxify. And in doing that, it uses up many of those nutrients and vitamins that the liver uses to get rid of things. And so here, for example, we can see if we're on statins for our high cholesterol, that uses up coenzyme Q10. It also uses up vitamins A, B12, D, E, and K. So when our medications use up those things out of the liver, now the liver doesn't have anything left to detoxify the real poisons that we're exposed to. So it's important to replenish the liver so it has all of those nutrients to detoxify. The next system to get rid of toxins is our urinary system. This is where things get converted into water-soluble things, excreted into the urine, and then eliminated through the bladder. Perspiration or sweat is the next way we eliminate toxins. So it's very important to try to sweat while you're trying to detoxify. And this is why saunas can become a very important part of a detoxification program to help eliminate those toxins every way that we can. So we try to encourage sauna use, especially while you're doing a detox. That can really help eliminate toxins out of your body and improve your health. This was a study in Finland where saunas are very common, and what they found was that men that use saunas more frequently than others tended to have a much lower rate of Alzheimer's disease and dementia. We now know that about 50% of Alzheimer's disease is probably contributed to by toxins. So by lowering their toxin rate or their toxin levels, they're probably decreasing their rate of dementia. So now we need to get on and do this detox. You can see why it's important to do this 1 or 2 or 3 times a year, just depending on what your exposure is to toxins. That's why we try to do this after the holidays, for example. We like to do one in the fall after summer, when you've been exposed to a lot of these toxins, both in food, again, water supply, things that we take into our system that we need to try to get rid of. So a couple times a year, it's good to try to lower the level of the water in the barrel. That gives your body more capacity to be exposed to things and improve your health. So thank you for coming tonight and listening to this. We're now going to get set on a detox program. You'll find more information as we go through how exactly to do this, what we need to do diet-wise, and how we're going to replenish all of these vitamins and nutrients that our liver needs to detoxify. Thank you.